Disclaimer: the information in this video is for educational purposes only and is not intended as medical advice. Please consult with a healthcare professional before trying any new health practices, especially if you have a medical condition like sleep apnea. This method is not a substitute for professional medical treatment. Hey everyone, and welcome back to the channel. Today, we're re-diving into a topic that's been buzzing around the health and wellness community: mouth taping. Specifically, can this super simple, incredibly cheap technique actually help with something as serious as sleep apnea? Some people claim it's a $1 fix that changed their lives. Let's break down the science, the risks, and what you really need to know before you even think about trying it. First off, what is sleep apnea? It's a serious sleep disorder where your breathing repeatedly stops and starts while you sleep. The most common type is obstructive sleep apnea, or OSA, where the muscles in the back of your throat relax too much and block your airway. This can lead to loud snoring, gasping for air, and waking up feeling exhausted no matter how long you were in bed. Over time, it can contribute to major health problems like high blood pressure, heart disease, and diabetes. The standard treatment is often a CPAP machine, which uses air pressure to keep your airway open. It's effective, but let's be honest, many people find it uncomfortable, bulky, and hard to stick with. This is where the idea of mouth taping comes in. The theory is pretty straightforward. By taping your mouth shut at night, you force yourself to breathe through your nose. Why is nasal breathing so important? Well, our noses are amazing natural filters. They warm, humidify, and clean the air we breathe, filtering out dust and allergens. Nasal breathing also increases the production of nitric oxide, a fantastic molecule that helps widen your blood vessels, improving oxygen circulation throughout your body. It also has a calming effect on your nervous system, which can lead to deeper, more restorative sleep. When you breathe through your mouth, you bypass all these benefits. Mouth breathing can dry out your mouth and throat, leading to bad breath and an increased risk of cavities. More importantly, for some people, mouth breathing can cause the jaw and tongue to fall back, further narrowing the airway and making snoring and apnea worse. So, the logic behind mouth taping is that by encouraging nasal breathing, you might help keep the airway more stable, reduce snoring, and potentially lessen the severity of mild sleep apnea events. So, does it actually work? This is where things get a bit complicated. There's a lot of anecdotal evidence out there. You'll find countless stories online from people who say mouth taping completely eliminated their snoring, improved their energy levels, and gave them the best sleep of their lives. For $1 worth of tape, that sounds like a miracle, right? But when we look at the scientific research, the picture is much less clear. There are a few small studies that have shown some promising results. For example, one study found that in people with mild obstructive sleep apnea, mouth taping did reduce snoring and the number of apnea events for some participants. Another small study showed similar improvements. However, these studies are very small, and the scientific community generally agrees that we need much larger, more rigorous clinical trials to say for sure whether mouth taping is a safe and effective treatment for sleep apnea. It's crucial to understand that what works for one person might not work for another, and it could even be dangerous for some. This brings us to the most important part of our discussion, the risks and who should absolutely not try mouth taping. First and foremost, if you have any kind of nasal obstruction, do not tape your mouth. This includes if you have a cold, allergies, a deviated septum, or nasal polyps. If you can't breathe freely through your nose when you're awake, you definitely won't be able to when you're asleep. Taping your mouth in this situation is incredibly dangerous as it could lead to a severe lack of oxygen. It's like blocking your main exit and your emergency exit at the same time. Secondly, people with moderate to severe sleep apnea should be extremely cautious. For these individuals, their airway is already collapsing significantly during sleep. While a CPAP machine actively pushes the airway open, mouth tape does not. There is a real risk that by taping your mouth, you could make the situation worse if your nose can't compensate for the entire breathing load. This could lead to dangerous drops in your blood oxygen levels. There's also the risk of skin irritation from the adhesive on the tape and the general anxiety or discomfort that can come from having your mouth taped shut. Imagine needing to cough or feeling nauseous in the middle of the night. It could be a very distressing and potentially unsafe situation. So, if you're still curious and you don't have any of the contraindications we just talked about, how would you go about trying it safely? The key is to start slow and always prioritize safety. First, talk to your doctor. This is non-negotiable. Discuss your symptoms, your interest in mouth taping, and get their professional opinion. They might want you to do a sleep study to understand the severity of your condition first. Never self-diagnose or self-treat sleep apnea. If your doctor gives you a cautious green light, don't just grab any old duct tape from your garage. You need to use a special kind of tape designed for skin. Look for porous hypoallergenic surgical tape or specially designed mouth strips. These are gentle on the skin and allow for some air to pass through in an emergency. Before you commit to a full night, try it out during the day for 15 to 20 minutes while you're awake and relaxing. See how it feels. Can you breathe comfortably through your nose? Do you feel any anxiety? This is a good way to test the waters without any risk. When you're ready to try it at night, don't seal your entire mouth shut. A common technique is to use a small piece of tape placed vertically over the center of your lips. This gently encourages your lips to stay closed, but can be easily opened if you need to. You should be able to open your mouth with minimal effort. The goal is to remind your body to use your nose, not to weld your mouth shut. And if at any point you feel uncomfortable, anxious, or like you can't breathe, take the tape off immediately. Your body's signals are your best guide. Listen to them. So, what's the final verdict? Is mouth taping a $1 miracle cure for sleep apnea? For the vast majority of people with diagnosed sleep apnea, especially moderate to severe cases, The answer is no. It is not a replacement for proven medical treatments like CPAP. The risks are real, and the scientific evidence is just not strong enough to support it as a primary treatment. However, for a very specific group of people, those who are chronic mouth breathers with very mild snoring or perhaps very mild OSA and who have been cleared by a doctorate, might be a tool to help encourage nasal breathing and potentially offer some slight improvement. But even then, it should be approached with extreme caution. Think of it less as a cure and more as a potential training wheel for better breathing habits. The real long-term solution often lies in addressing the root cause of your mouth breathing, whether that's allergies, nasal congestion, or just habit. Working on nasal breathing exercises during the day can also be incredibly beneficial. In conclusion, while the idea of a simple, cheap fix is tempting, sleep apnea is a serious medical condition that requires a serious evidence-based approach. Don't let a viral trend on the internet replace the advice of a qualified healthcare professional. Your health is far too important. If you suspect you have sleep apnea, the first and most important step is to see a doctor and get a proper diagnosis. They can guide you toward treatments that are proven to be safe and effective. Thanks so much for watching today. I hope this gave you a balanced and clear perspective on the mouth taping trend. If you found this video helpful, please give it a thumbs up and subscribe for more deep dives into health and wellness topics. Stay safe, sleep well, and we'll see you in the next one.